Hey folks, Dr. McCarthy here. I want to welcome you to our Thursday night workshop tonight. We're going to talk about chronic health solutions. We're going to talk about a couple of things that most folks dealing with these chronic health problems don't know, things that are just not looked at in the traditional healthcare approach. So, we're going to talk about all of these things, but then we're going to talk about some common threads that run between them. And I get a little bit excited about this because, I've got... I live in a very medical model right here in Greenville, North Carolina. We're surrounded by the medical school, the university, the hospital. It's the largest employer. People come from all over Eastern North Carolina to come to this mecca of traditional healthcare, and it is fantastic. It's phenomenal if you've got an acute problem. However, if you've got a chronic health problem, the system just falls flat on its face. So we're going to talk about these things tonight. First, one of the things that we do with all of our chronic health problems is oxygen therapy, exercise with oxygen therapy. I'm a contributing author to this book, Energize Your Brain, Change Your Life, An Introduction to Exercise with Oxygen Therapy. And if you are not giving your body what it needs to get well, oxygen, you are not going to get the maximum results. Oxygen therapy is critically important. And then we've created a bunch of different DVDs, and these are educational DVDs, and it's not a day goes by that one of our patients doesn't take one and says, oh, you treat that? Okay, I got a cousin, I got a sister. The first one we created, Breakthrough Treatments for Chronic Health Problems, the Management of Chronic Neurological and Metabolic Conditions. And that's what all of these things have in common here. All of these conditions, they all have a neurological and metabolic component to them. Yet we don't look for that in the traditional healthcare approach. Breakthrough treatments for fibromyalgia, one of the most common conditions that we see here in our office. Breakthrough treatments for hypothyroid and Hashimoto's disease. If you've got a thyroid problem, chances are it's autoimmune. And then breakthrough treatments in peripheral neuropathy. So there's a lot of different kinds of treatments that we can do, but it's a different approach for everyone. The traditional healthcare approach is kind of like, hey, everyone take this pill and everyone take that pill for this problem, and it doesn't work that way. There is no one size fits all. So some of the things that we're going to talk about tonight are neuropathy. And I know my buddy Wendell has shared this on his group, and there's a lot of folks out there, and I feel your pain. I'm in your group. I see your posts, and I just wish that, I wish I could fly you all in here and show you the way things need to be done. Neuropathy, weight loss resistance. This is a huge problem. Some people come in here just for weight loss resistance. Other people come in here for different health problems, but they are obese and they're overweight. And one of the nice side effects of our treatment plan is that we remove weight loss resistance. People can start to lose weight. Fibromyalgia, chronic fatigue, autoimmune issues, migraines, diabetes, fastest growing disease in Eastern North Carolina. Anxiety, depression, sleep, insomnia issues, digestion, IBS, Crohn's, whatever it is, GERD, reflux. Medicines don't fix that. It actually makes it worse. ADHD. What's the approach for that? Absolutely, a drug. Methamphetamine. So we've got, kids running around our schoolyards who are doped up on methamphetamine. And do we think, I understand from a teacher's perspective, she's very happy that the kid's sitting still. But we're creating a generation of methamphetamine kids. That's insanity. So we need to look at three different components to figure this out. One is neurological, and it's just not done, especially when we're talking like neuropathy patients. You go to your general practitioner and they look at you and you tell them, burning, numbness, tingling, excruciating, I'm on fire. You explain it to them, however, and they'll say, well, Lyrica, gabapentin, Neurontin, whatever the drug du jour is, and you'll take that. Maybe it'll work for a little period of time, but it never really fixes. It can't fix your problems. And then they'll say, okay, it's still not working. We'll up the dose. We'll send you over to the neurologist. And the neurologist will do like a 2-minute neurological evaluation. That's obscene. You've got to do an in-depth, thorough neurological evaluation to find. Then what they do is eventually they'll put you onto the, do the NCV EMG, and, that's gut-wrenching. Lots of folks that are dealing with a small fiber neuropathy, they do the punch biopsies, whatever it is. All of these things, all of these tests that they're doing is not to figure out how they're going to cure you. All these tests that they're doing is to figure out what they can tell you that you have. And in the grand scheme of things, I really don't care what the name of my problem is. I care much more about, why do I have this problem? Where did it come from? We see tons of folks, like I said, dealing with fibromyalgia, chronic fatigue syndrome, and I'm going to tell you that each one of these people is different, and each one of these people needs different treatments in order to get them well. Well, it all starts with neurological. We do an in-depth neurological brain, central nervous system, peripheral nervous system evaluation, so we can find out where in the nervous system we've got issues. And we do things called brain-based therapy. We have folks do brain-based therapy while we have them on oxygen. If it's someone that's dealing with neuropathy, we do this. We've got this phenomenal, very expensive machine that we utilize, and we just have folks sit down in the chair, nice vibration chair, breathing their oxygen, doing their brain-based therapies, and you get phenomenal results. But you got to figure out which therapies are going to work best for which folks dealing with neuropathy. Fibromyalgia, same thing. 10 people come in diagnosed with fibromyalgia. Well, they're all going to get the same drug, but they all have different issues. Some folks have neurological issues. Some folks have gut issues. Most folks have a little bit of both. So we need to work on what's going on inside your gut too. Metabolic conditions. We talked about that earlier. Some of the things that we need to look at is blood sugar dysregulation. When people have blood sugar that's going up and down, that destroys your nerves. And I'm not talking about folks that have diabetes. Diabetes is bad, but also fixable. Type 2 diabetes is booming here in eastern North Carolina, and there's not a week that goes by that we see folks that are getting off their pills. They go to their doctor, and the doctor says, we better stop taking that stuff. So if you can fix blood sugar regulation, it's a lot easier to fix neuropathies and weight loss and fibromyalgia and autoimmune issues and migraine headaches. But if you don't address blood sugar regulation, you're never going to get well. So we look at blood sugar on all the folks. We look at adrenal gland function. We look at thyroid function. We look at nutrients like vitamin D and magnesium and methylmalonic acid, your B vitamins, your omega fatty acids. And when you look at all of these pieces of the puzzle, we can say, okay, you got this, and this wrong. This is what we need to do to fix you. You've got to fix all the underlying things. Food sensitivities are huge. The number one food sensitivity, I know most people out here know it, gluten. I was the very first certified gluten coach in the state of North Carolina. I've been screaming about gluten for years. And one of the first things that we see gluten attack is your nervous system. And so if you've got a gluten sensitivity and you don't know it, and you keep eating gluten, you can take all the magic pills you want. Neuropathy is not going away. Your migraines aren't going away. Your diabetes, not going away. So you've got to address that. Now, we test for 95 different foods. So people will sometimes say, oh, well, I went gluten-free for a little while and it didn't help me, so my doctor said I must not have any gluten issues. Well, that just means your doctor doesn't understand food sensitivities. If you've got, say, sensitivities to 12 different foods, gluten's one of them. You take gluten out, but you still keep eating the other 11. Do you think you're going to get well? Absolutely not. So unless you go to someone who understands food sensitivities, the proper testing that needs to be done, and then how to properly manage the diet going forward, you're not going to get maximum results. Next test that we run on folks is a nutrient deficiency test. Nutrient deficiency test tells us, hey, look, you're low in vitamin B1, B6, and B12, your vitamin D, and your omega-3 fatty acids. Well, guess what? If you've got neuropathy and you're low in those B vitamins and you're low in the omega-3s and you're low in vitamin D, you are not getting well. It's not going to happen. So unless you're getting the proper testing done, you're not going to know what you need. So, you know, it's nice. There was another group that I belonged to a long time ago, and they had like 47 different supplements, you know, $500 a month to pay for the supplements, and they were assuming it's a one-size-fits-all, and it's not. In our office, we dig and we dig and we dig, and you need to find a doctor that's going to do the same thing for you. So if you're dealing with any of these chronic problems, and you go to your traditional provider, and they say, well, here's the pill for that, and it doesn't work, and you go back, and they say, well, here's another pill for that, you know, time out. Time out. How many times are you going to keep doing the same thing and getting nowhere? You know, that's the definition of insanity. You keep doing the wrong thing over and over and over and over, but you keep expecting a different result. We're waiting for the magic pill. And, you know, again, I hate to be the bearer of bad news, but there is no magic pill coming. Because if you have 8 different things, you can't take one pill to fix those 8 different things. You have to find out what it is you need and then get those problems addressed. So if you or someone you know and love is dealing with neuropathy, weight loss resistance, fibromyalgia, autoimmune issues, exploding, going through the roof, autoimmune issues, Hashimoto's, lupus, scleroderma, type 2 diabetes, MS, we see lots of folks dealing with that, migraine headaches, diabetes, anxiety, depression, sleep issues, insomnia, digestive issues, ADHD. You know, there's pills for all of these things. But if the pills worked, you wouldn't be watching this video right now. You know, I wouldn't have an office full of people all day. I wouldn't have these things listed on the board. So if you're sick and tired of looking for the magic pill and you want to dig and actually find the underlying cause of your issues, I will help you. All right? There's a couple of different things that we can do. One, if you live nearby, come and see me. Call the office, and I'll put the phone number up later. It's 252-758-2222. Call the office and tell the girls that you want to schedule a free consultation. And we give you 15 minutes of my time. Just you and I sit down, talk. You ask me questions. You tell me your story. I give you my 2 cents. And I let you know if it's something that I think we can help you with. Folks that live far away, I'll do the same thing. We do it over the telephone. We have a lot of patients that we treat from a distance. Obviously better if you're here. Some folks are just going to need definitely like brain-based therapy and oxygen therapy, and I'll tell them, look, I'm going to help you find somebody. Very rarely am I stuck trying to find someone to help you. There's someone going to be close enough by. We have folks who drive to my office from 2 hours away. You know, 2 hours here, 2 hours back. So we're going to find you someone as close as we could possibly get. But this is like life-changing information. Food sensitivities, nutrient deficiencies, and then toxicities. Heavy metals, environmental toxins, stuff that's just built up in your body over the years. Well, again, with the neuropathy, one of the big things that we see are fluoroquinolones. There's a nice group that's on Facebook as well. Fluoroquinolones are directly related to nerve injuries. Fluoroquinolones are a brand, a class of antibiotics. And in some folks, they are just absolutely deadly and destructive and like change your life after taking just a couple of days of one of those things. If you haven't been evaluated for toxicities as well, you know, you're missing the boat. All right, so I get home later this evening. I'm going to post this up. I'll put my information in the comments section down below. You guys can ask questions. You can call us, set up a phone consultation, or come into the office for a consultation. And I'd be more than happy to give you my time. This is a passion of mine, helping folks who are dealing with these issues. And so I'm going to do everything in my power to help you get well too. Hopefully you found this information valuable. If you did, like it, comment, share, tag your friends so they can watch it later. And I hope to be able to help you to find somebody or find some way that you can come and see me. Thank you very much. God bless you. Have a good night.